My name is Marvin Slosman. I'm the CEO of InspireMD.
Okay, awesome. All right, tell me a little bit about Dr. Metzger.
So Dr. Metzger, I met by way of introduction from Dr. Gary Rubin and Dr. Christina Brennan. We were looking for a global primary investigator for our U.S. clinical trial, and he was obviously at the top of our list, and we made a great introduction through these remarkable people, and he agreed to participate as the principal investigator.
Awesome. Tell me a little bit about Dr. Rubin.
So I met Gary Rubin by way again of Christina Brennan. He had a long relationship with her at Lenox Hill in a previous life, and he was just a wonderful gentleman. His accomplishments are sort of beyond compare, but beyond that, he was just a terrific gentleman and believed so much in our technology and our company that in fact he agreed to serve as a director for our board of directors in addition to being serving as a consultant and really being a huge advocate. I mean, he spent his life's work trying to change the way carotid artery disease is managed, and he's been connected intimately at every technology platform over time, and he really believed that this was the true game-changing technology. So we were thrilled to have his counsel, but love having him on our board of directors as well. And he's indirectly my boss now, so I have to...
Okay, tell me a little bit about why we're here today in the CGuard stent.
Yeah, so CGuard is sort of that third generation, the next generation of carotid stent platform, and the real differentiation is the micronet mesh.
Let's start that
You
one
don't start
over.
over.
So CGuard is the next third generation stent platform, and the real differentiation is the micronet mesh, which is the overlay that lays on top of the stent itself. And what that does is both protects the patient during the procedure, but more importantly post-procedurally. Because what happens is when the stent procedure takes place, there's plaque protrusion that gets through the stents of the stent itself. And so when it gets into the blood flow, small particles break off and they go to the brain. So many of the mini strokes that occur happen after the procedure because you don't have that extra level of protection. So what micronet does is it provides that layer of protection that other technologies don't, and it gives you that sustained protection after the procedure is done. We always like to say the delivery systems are for the physicians, but the stents are for the patients.
Anything?
Let's talk a little bit. Can you talk about the results you've seen out of Europe and Tel Aviv?
Yeah, so we serve 33 countries right now, where we're approved in 33 countries. We've sold over 23,000 stents, so this is not a new technology. And undisputed, the evidence here is that our complications or issues related to our stent are minimal. They're the best in the industry. And so we have a proven track record of performance outside of the U.S., and this is that next remarkable step in getting into the U.S. market by participating in this trial, getting it completed, and getting FDA approval. So it's that next level that we've been waiting for a long time. So it's exciting.
So you spend a lot of time in and around hospitals and cath labs like these, correct?
Right.
Is there anything special about Holston Valley that you want to say?
So the people are remarkable. I mean, when you switch out all the technology, it could be anywhere. But I think the ability to perform these kinds of procedures efficiently and effectively, it's really the differentiation. The people are wonderful. Dr. Metzger obviously has this down to a science, and everybody has been wonderful. So we love being able to prove our technology in a very efficient environment and a friendly environment, of course. So we're thrilled to be here. So it's a wonderful spot.